name is Rachel Eddy, and I'm going to be your student nurse practitioner today. I have here that your name is Maverick. Do you go by Maverick?
Yes.
All right, Maverick, so today we're going to be doing a focused exam of your cardiovascular, respiratory, and peripheral vascular systems.
Okay.
All right, so we'll go over your vitals first. Maverick is a 25-year-old male. He appears well-groomed. He's in no distress, answering my questions appropriately, and is alert. He is, his height today was 5'8". Weight was 200 pounds. Respiration rate 18. Pulse is 70. Blood pressure 118/72. Temperature was 36.8 orally. And he rated his pain a 0 out of 10 today. Okay, perfect. Looking at your respiratory general appearance, again, not any acute distress, breathing comfortably, no retractions or accessory muscle use. Your color is good, no pallor or cyanosis is noted. No audible wheezing is heard, and your trachea appears midline. I'm going to come behind you. I'm going to feel your thyroid gland, okay?
Okay.
Okay. Any tenderness with me touching?
No.
Okay. No tenderness of the thyroid gland. Thyroid gland is symmetric and without any enlargement. I'm going to have you move over to the couch there and lay at about a 30-degree angle for me. Looking at you, I see no jugular venous distension, but I'm going to measure your jugular venous pulsation. Okay, I'm going to have you look over to the left for me. If I was able to, I'd dim the lights, use some tangible lighting, and get the jugular, okay? Okay, right-sided JPP is 6 centimeters. I'll have you look over to the other side for me. Again, I would dim the lights. Okay, and JPP on the left side is 6.5 centimeters. These are normal findings. Okay, I'll have you stand up for me. Okay, looking at your anterior chest, it appears symmetric. You have one scar on your right chest. No other lesions or abnormalities are seen. I'll have you turn around. Okay, looking at your posterior chest, again, it looks symmetric. No lesions or masses are seen. I'm going to measure your chest now. I'll have you turn over to the side. Okay, and no spinal abnormalities or filled chest was seen either. I'll have you lift your arms up for me. Okay, AP diameter is 30 centimeters. Have you turn to the front for me? Lateral diameter is 50 centimeters. These are normal findings. They're not indicative of barrel chest. Okay. Again, no increased work of breathing. Patient appears comfortable. No accessory muscle use. All right, now have you sit back down for me. Now look at your hands now. Hands are warm and pink. No edema or lesions. No clubbing of the fingernails. I'm going to test your capillary refill. The capillary refill is less than 3 seconds bilaterally in the hands. Okay, feet are warm and pink. Again, no edema, no lesions. There is hair growth on the top of the feet and the toes. Checking your capillary refill of your feet. Okay, capillary refill. The feet are less than 3 seconds bilaterally. Okay, now I'm going to feel your pulses. Feel your carotid pulse. Carotid pulses are 2+ bilaterally and equal. Feel your brachial. Okay, I'm coming behind you. Okay, brachial pulses are 2+ bilaterally and equal. Again, for your radial pulses. Okay, radial pulses are 2+ bilaterally, and again, they are equal. I'm going to have you move over to the couch again for me. I'll have you lean a little bit over onto your left side. We're going to be feeling for your point of maximal impulse. It's going to be at your midclavicular line at your 5th intercostal space. Okay, point of maximal impulse is felt. It's brisk and tapping, feels around 2 centimeters. Okay, now I'm going to feel for the systolic impulse of your right ventricle. It's your left sternal border in the 3rd and 5th interspaces. Okay, let out your breath for me and then hold it. I feel no sustained movement. Now moving on to your pulmonic artery impulse. This is your left 2nd interspace. Okay, again, let it out for me and hold it. Okay, no S2 was felt. Now feeling your aortic outflow area. It's on your right 2nd interspace. One more time, let your breath out for me and hold it. No pulsation was felt. I'll have you get up for me now. I'm going to palpate your chest. Any tenderness with my touching?
No.
Okay, no tenderness of the chest, no subacute emphysema was felt, no masses felt either. Okay. I'm going to put my hands here. I want you to take a deep breath for me. Okay, anterior chest is symmetric with expansion. I'll have you turn around. We'll do the same thing on your back. Okay, take a big breath for me and let it out. Okay, symmetric expansion of the posterior chest as well. And I'm going to be testing for tactile fremitus. Every time I touch your back, I want you to just say 99 for me, okay?
Okay. 99, 99, 99, 99.
Okay. No tactile fremitus felt on the posterior chest.
99, 99, 99.
Okay, great. No tactile fremitus felt on the anterior chest as well. These are normal findings. Now I'm going to percuss your chest. Turn around, and I'll do the same on your back. Okay, great. You can sit back down for me. Okay, I'm going to be listening to your carotids now. Okay, I'll have you let out a breath for me and hold it again. Okay, no bruits of the right carotid. Heard. Okay, again, let it out and hold it. Okay, again, no bruits heard of the hurt on the left carotid artery. Okay, now I'm gonna be listening to your heart sounds. Do you care to sit back down for me, and we'll have you lean back a little bit. Listening to your aortic valve. Okay. Listening to your pulmonic valve. Listening to your tricuspid valve. Listening to your mitral valve. Okay. Now I'll be using the bell of my stethoscope and listening at the left sternal border and the fourth and fifth intercostal spaces to the apex of your heart. Okay, heart rate was normal, again around 70 beats per minute. No extra sounds or splitting. S1 and S2 were heard without one being louder than the other. S3 and S4 were not heard in the apex, and no murmurs were heard. Right, I'll have you get back up for me and we'll listen to your breath sounds. Okay. Okay, deep breaths for me with your mouth, out your mouth. Have you turn for me? Okay, again. Lung sounds are clear in all lung fields. No rales, bronchi, crackles, or wheezing were heard. You can have a seat back for me. Okay. I'm gonna look at your arms now. Arms appear symmetric, no discoloration or edema. Radial, brachial, pulses were felt earlier and were 2+ and equal bilaterally. I'm going to feel for your epitrochlear lymph node now. You can rest your arm for me, just relax. Okay, any tenderness?
No.
Okay. Relax your arm again for me. Okay, any tenderness?
No.
Okay, no tenderness of the epitrochlear lymph node reported by the patient and no enlargement. Okay, now I'm going to have you put your feet out for me. Okay, legs appear symmetric. Again, no discoloration or edema. Okay, I'm going to feel your pulses now. I'll have you relax, please.
Relax, okay.
Okay, I'm going to feel for your femoral pulse. I'm going to get femoral pulses are 2+ and equal bilaterally. Feel your popliteal. Popliteal pulse is 2+ bilaterally. Okay. Posterior tibial pulse is 2+ bilaterally. dorsalis pedis pulses are 2+ bilaterally. Right, so now I'm gonna have you move back over to the couch for me. Okay, I'm gonna feel for your inguinal lymph node. Okay, any tenderness?
No.
Any tenderness?
No.
Okay, no tenderness reported of the inguinal lymph node and no enlargement. Right, now I'm going to listen to your aortic, renal, and femoral arteries for bruits. Okay. Let out your breath for me and hold it. Okay, no bruit of the abdominal or the aorta artery. Again, please. Okay, one more time. No bruit of the renal arteries. Heard. Okay, and I'm gonna listen to your femoral. No bruit of the femoral arteries heard. I'm going to feel for your aortic width. Okay, any tenderness? Okay,
Nope.
No tenderness of the aorta, width and pulsation feel appropriate. Great, well thank you. That concludes our focused exam.
Thank you.